Well, good morning, everybody, and welcome to this week's meeting of the Tacoma Pierce County Coalition to End Homelessness. We do, as I mentioned just a second ago, have our magic number of 30 plus people in the room, so I think we can go ahead and get started. Rosemary, would you like to kick us off this morning?
Thank you, Rob. We meet every week here to, as the title Rob gave there, to work to end homelessness. And we've been doing this for a lot of time, a lot of years, but there's still so many of our neighbors who are living unhoused. And the recent sweeps by local governments point out the unsafe conditions and the failure of our common imagination to find safe shelter for all of the folks who live in our area. For some of us, some of the time, it seems like the hope of ending homelessness is an impossible dream. But we do find that it's a dream that touches everything. And so I like to start our days with a poem, and it's Black History Month, and Lucille Clifton is just such a wonderful poet. And she has a great little poem on dreams that I think could set us up well today. So I'd like to share that with you. She says, "Some dreams hang in the air like smoke. Some dreams get all in your clothes and be wearing them more than you do. And you be half the time trying to hold them and half the time trying to wave them away. Their smell be all over you and they get in your eyes and you cry. The fire be gone and the wood, but some dreams hang in the air like smoke, touching everything." So yes, it touches everything. And here we are meeting today to continue that dream together. I'm delighted that we'll have a chance later on to hear from Verna for some ways that we can have compassion for ourselves as we do this dream together. And I just wanted to point out as we begin, for those of you especially who are new, the few of the norms that we have for our time together. And so we ask very practically that when you wish to speak, that you use the hand raise function if you can get to it. And if not, wave wildly and somebody will notice. Also, keep ourselves on mute when we're not speaking. I fail at that a lot. So if you do it, don't worry, just try it again. And then also to turn the video off if you're doing other things or trying to multitask. Also, in this group, we find the chat is a place where networking happens delightfully, and it's not any kind of bad form to take time to privately interact with people on the chat. So it is saved and you can save it yourself. If anyone doesn't know how to do that, just send me a private message and I'll let you know how to save it for yourself. Otherwise, it'll be saved by the group for later retrieval. And also we have a number of norms that we agreed to about how we interact with each other. Mostly those are, Rob, I don't know if you've posted them, but if you do, if you can see those, we're really trying to make sure that with the large group we have, that we have shared experiences, that we aren't just hearing from a few people, and that we do hear from everyone as much as possible. So that means in this kind of a space for this amount of time that we have to pay attention to the space we take up and the space we don't take up, and to pay attention to the power dynamics of who's speaking more and who is not speaking more. And also to realize that while we may say things that are unintentionally critical or painful to others, that we take a responsibility for the consequences of things. So those are our hopes. And I'd like to invite people who are new or who are returning from a time away to just let us know you're here, your name, and if you're with a group, we may have a lot of newer people and right now, so we won't take time to have you explain all your reasons for being here, but just if anyone is new today or returning, this would be a time to raise your hand or just unmute and speak. Janet, go ahead.
Well, I'm Janet Thiessen, and I was here last week. That was my first week. And I am just really interested what you all are doing, the wonderful things. And I am with a little group or bigger group called Compassion Tacoma. And we are just trying to gather information, see how we can support those people that are already doing the work. And
Thank you, Janet.
well, thank you. And you guys have been a wonderful source of information.
Well, welcome, and we look forward to working with you.
And I'm Janine Provosic. I came here last week, and I'm involved with 350 Tacoma and the conversation, and just trying to learn more about the homelessness situation since it's so devastating.
Thank you, Janine, for your involvement, and look forward to feature 2.
You bet.
So my name's Judy Lee. I'm with, this is my first time. There's just a lot of homelessness in our neighborhood, but I am on the Aspen Court Community Education Committee, and I serve on the Shaska Safe Streets, and I'm really excited about what you're doing. I know you were recently contacted for one of our homeless areas and did a great job. So appreciate all the work you are doing and hope to volunteer and assist as much as I can to help people transition into permanent housing.
Judy, thanks for sharing the dream. That's great to have you. Well, thank you all. If there's anyone else here who hasn't had a chance to do an introduction, you can also put this in the chat. Let us know who you are and how to contact you and what you're interested in, and people will be able to follow up with you. I wanted to, before we end this part, sharing the dream is really important, and sometimes we take on a lot of work and sometimes we can't take on as much. And I think Verna will help us with thinking about what kind of work we should take on a little bit later. But I wanted to let you all know that one of the very active participants in the coalition, whose energy is just beyond me most of the time, is Maureen Howard. And she asked me if I would let you all know that she's taking a medical leave from this work as much as she needs to for the next 8 months. She is currently a patient at Multicare's Regional Cancer Center. And so she has an optimistic outlook. People who know her well should feel free to reach out. And she's working to distribute the kind of work that she's been doing so well for us, so that we can carry it on and in her absence. So she may be in and out, but for right now, the focus needs to be on her health. And so she wanted you all to know. And so we want to honor her work and also her need to be in this new space for a while. So with that, Rob, I'll turn it back to you.
Thank you, Rosemary, and thanks for sharing that news. And I know we all support Maureen in her health battle. So let's move on to our first regular item in the agenda. And today, if you looked at the agenda that I emailed out yesterday, you'll notice that I left considerably more time for the This Week on the Streets section of the meeting today. And that's because at our steering committee meeting and in earlier meetings this week, members of the coalition have been expressing frustration with what we're seeing on the streets this week, especially in the wake of the ongoing cleanups and sweeps that have taken place under the 705 encampment. It's at East 72nd and I Street, and multiple sweeps in the Fife area. So we wanted to carve out a little extra time for us to just discuss as a group what we're seeing, where we're seeing people moving to, and what needs there are, and just kind of to use this time to gather together and share our thoughts and frustrations about what we're seeing on the streets. So I will open the floor if you want to use the raise hand function or the chat, or wave your arms in the air to let me know you want to speak. That would be great. I don't know, Richard, would you like to speak? I know you've been out under 705 every day since the sweeps began down there. Not to put you on the spot. Anyone else who wants to talk about what they're seeing? Jeffrey?
Good morning, everyone. The sweep at 72nd and I was complete. There is one camper still there, and nobody seems to be wanting to move them. I had seen several campers heading west on 96, and I have seen several new tents along, new tents along.
I know.
And so I suspect that was who ended up down there. There was one thing that I noticed was a lot of the campers at 72nd and I had vehicles. So it's a new dynamic, I guess. 705, when I drove by yesterday, it looked like, I may be wrong, but it looked like half the campers were still there. And it was still a mess. J Street up on Hilltop is filling up. And I did see onesie twosies building. There's 3 tents now under the Yakima Bridge on Center Avenue. And I've seen a couple of trucks with gear right around the Thompson Street Bridge. And that's what I've been seeing so far.
Rob, can you hear?
Yeah, I can hear you, Richard. And thank you, Jeffrey.
Sorry, I was having trouble with the Zoom function. Yeah, I'm a little, I don't know, agitated with the whole situation. Let's be clear about a couple things. The coalition has a position opposing sweeps. And in the last couple of weeks, there have been 3 sweeps. They swept in Fife. They swept at 72nd in Tacoma. They swept at 705. I think it's important that the coalition step up. If they say they oppose sweeps, the coalition needs to oppose sweeps. And right now, what I see, I like that phrase you just used, onesies and twosies. It seems there are probably, I don't know, 200 to 300 people on the move right now. What I was told at the 705, which I don't know how many people were down there, but not one person, not one, nobody accepted shelter. Nobody. Which means to me, it was an absolute failure of outreach. I mean, nobody accepted shelter. That means they're all on the move. Everybody is on the move. Onesies and twosies. I'm seeing people in doorways, on park benches, under different bridges. I mean, they're all over the place right now. It's a complete failure. It's a complete failure. So they're moving people, they say trespass or health and safety. They're moving people because of a complete failure to clean up and provide basic sanitation to the encampment. I mean, 705 was filthy. 72nd was filthy. Fife was filthy. So they don't clean it up for 6 months and then say, hey, it's filthy. It's we gotta move these people because of health and safety. You need to, I mean, if you haven't been out, come on out. You need to see what's going on out there on the street. So yeah, 705, it's not half. I'd say there's probably, they've probably got 3/4 gone. I'm going to go down in a few minutes, but it's an abominable situation what's going on out there, and I think I don't know. I'm still new to this. I don't know what the coalition's role is, but I think people ought to be pissed off about this. They're not giving them shelter. They're failing in their outreach. They give them 7 days. 7 days. They should give them a month maybe to do the outreach, so that people can be put in, that they can coordinate with people and get them into shelter. But right now, drive around downtown, drive around the county. There's a few hundred people that are stumbling around, pushing their carts and looking for where they're going to live next. And I go out there a couple times a day, and I'm not happy with it. And I don't think you should be either. That's what I get to say, I guess.
Thank you, Richard. I think a lot of folks are with you and feeling that same frustration and anger. Ed, you have your hand up.
Yeah, I was down there on Friday last week and took some pictures. Do you want me to share those?
I can. Here, let me give you the ability to share your screen.
Okay.
You should have that now.
Here we are. So can you see those, the encampment?
Yeah, just came up.
Okay. I walked around with what we used to call the hot team. I can't remember the name of it now.
They call them the HEAL team now.
HEAL team. And their assessment of this non-sweep, supposedly, is that it would take a week to 2 weeks to be completed. I spoke with people from the encampment, and no one had any idea of where they were going. And the other thing was that the HEAL team was saying that they had places for people to go. But the problem with the places that they had, 2 weeks before, they had been active COVID outbreak locations. So if I'm a homeless person and you say I have to move, and the option comes with a percentage of people dying, I'm probably not going to take your option. I'm going to probably go on my own. So as far as having a place for people to go that is safe and acceptable, the city failed. And this decision was made by the city manager after she had been warned about the number of sweeps going on in the area, and how there were very little resources to offer people that didn't have some sort of death associated with it, even if it was a small percentage. So yeah, I think the city failed completely on this.
Thank you, Ed. Monique.
Yeah, so I went by there as well, and let's be honest, 705 should have been broken up a long time ago. Got very dangerous, and they should have found some place for people long ago. These evictions, as Stacy calls it, because it's not a sweep,
Yeah.
these people are not trash, I agree 100%, Stacy. They have got to find something prior to. We do not have the space for people. If you think about all those, just the people under 705 and what they have in terms of their belongings, and then trying to take all those people and put them into a shelter, it doesn't work. We got people piled on top of people on top of people. We need to do something different. There's got to be more tiny home villages. There's got to be more tent cities so we can put people in a place safe. They don't need to be evicted, and we can find them places to live. I'm curious, Richard, he brought up a good point about what we are going to do. We're definitely against moving people and not having anywhere for them to go. But I'm wondering, Richard, if you have any thoughts about how we as a coalition should step up.
Monique, that question came up with the, what do they call themselves? The Compassion Tacoma. I mean, the recommendation that I have right now, I don't like them to begin with. I'm perplexed that the city is talking about a camping ban, but there is no camping ban now. And yet that doesn't seem to stop them from going out and removing people from these encampments. The simplest suggestion I have right now, and I don't like any of this, but is what I said a few minutes ago, and maybe the coalition could draft a letter to the city, but my suggestion is give them 4 weeks notice, don't give them 7 days notice. And then there is time to do outreach. But to move that many people, I don't know, 100, 150 people out of the 705, and not one person, not one accepted shelter, not one of them. That is an absolute failure of outreach. And so I guess the simplest suggestion that I could offer from what the coalition could do is recommending at least a 4 weeks notice instead of a 7-day notice. So I mean, that's all I got right now in terms of maybe a suggestion that could make a difference.
Yeah, that's a good response. I don't think it's a failure of outreach though, Richard. I think it's a failure of the system not having what we need. We need more resources. Oh,
absolutely. I mean, it's a failure, but what they do, I mean, the interaction right now, the way they do it is outreach. That's why I say that. You're right. I mean, it's an absolute failure of the system and all sorts of things. But what I see, I mean, what the mechanism that I see out there is a mechanism of outreach, which means that they're not communicating. They're not. And you're right. But what I see is the outreach is the means by which they do it. So.
Right. What last comment I'm going to make, what perplexes me in this country is that we can quickly find a place to house refugees, but we have all these people on the street and we can't build or take some of these abandoned buildings and put people in them. I just, for the life of me, don't understand that.
Yeah. Thanks, Monique and Richard. And this is exactly why we wanted to have this conversation. Teresa, I see your hand up next.
So in response to Monique's question, can you say litigation? I think there's a lot of fear of litigation that stops communities from doing the right thing. I also wanted to respond to Richard. I'm so thankful that you are down there doing what you're doing. And it's very easy. When I go out to the encampments near my neighborhood, I'm almost always the only one there. I think it's important to know that you're there at some time, somebody else is there at another time, and all of us are kind of peddling. It's not. I don't think you'll find anybody in the coalition who's sitting on their butt. So maybe look at what other people are doing. It may not be the same as what each of us are doing, but it's important to acknowledge and celebrate it. the last point I want to make is it's not helpful. Last night, someone came by, I didn't see who, but dropped off a giant stack of cordwood on our block again. And what's happening is this community has suffered some fires, and you've got to notice that one of the justifications that's given when there are sweeps, and I still call them sweeps because that acknowledges what is happening. People are being treated as if they are debris. And none of the jurisdictions actually like that term. They'd prefer that it be called something else. I think it's fine to call it evictions too, but I think calling it a sweep does convey the fact that that is what is happening. People are being swept up as if they are debris. So I want to say, if any of you know anyone who's dropping off large wooden structures, which are just, they're like kindling. If you had been in our neighborhood as we watched the trees go up in flames, as we watch our mural being destroyed, you would also not want to have fires in unsafe places. We need campsites, established campsites with campfire pits, with fire control possibilities. We need to have that level of camping for the people who need to live in tents right now. And they shouldn't need to live in tents, but absolutely until there is any kind of income inequality, and until we end the income inequality that is behind all of this, there will be people in tents. So let's take care of them and let's provide a space for all of us.
Thank you, Teresa. Janine, your hand's up as well.
I was on the CVS meeting last night, and they were talking about the fact that this was a total failure on the 705 sweep. And I think it was Sarah Rumba, I can't remember who was talking about maybe a designated area, because it's so hard when you have all these little camps all over to try to assess and bring in resources and figure out what they need. Have they talked about a designated area where there's running water and there's monitoring and they put some money into that? I mean, that to me makes way more sense. And then those that are committed to camping, at least we know which ones. And I think many of them, once things are calm and it's not like Lord of the Flies where they're living, they might indeed sort of rise to a higher level of wanting something for themselves. So I don't know if that's on the table, because I'm just new to the topics here.
Yeah, so I can give a little bit of background on that. Almost a year ago, the city of Tacoma did a search for across city-owned properties for a potential site to host. Early on, they were talking about hosting a low barrier site of some kind. That search led to a property at South 69th and Proctor Street that became the location of a Lehigh tiny home shelter that's at that site. But that didn't really meet the criteria of a low barrier site. So far the city has been unable to locate at least city-owned property where they believe it would be appropriate to have a low barrier site. And I don't know that the city has actually publicly defined what a low barrier site would look like. But that's some of the background. There has been a search. I get frustrated by that as well, because I think I recognize a search was done, but I think more should be done. So that gives you a little bit of background.
Okay, thank you.
Yeah, you're welcome. Janet, you had your hand up as well.
Question for Dick. I think I heard you say twice that the people at 705 wouldn't accept shelter. So are you saying that there are beds and they were saying no?
Good question.
There. Hey, Dick.
So I'll let Richard answer, but maybe Garrett, could you give us I know you said in the chat that what was available this week was essentially spaces in congregate shelter Do you know how many spaces, have a sense of how many spaces are currently available? I mean, at the last update, which I will say, people can look that up for themselves on the overnight shelter link on the pchomeless.org website. So you can get a snapshot of what spaces are available and what kind of individuals can be served by the spaces that are available, whether it's a space for single men, single women, women and families, that sort of thing. But Garrett, do you have a sense for how many spaces?
Sure. So we typically have no space in any of our non-congregate shelters. So we have significant backlogs in all of our family shelters currently. So Adams Street, Alzheimer, Bethlehem Baptist, YWCA is domestic violence focused, as are KWA, but they both have wait lists. And then you shift onto our single adult or couple shelters. And so we're talking about our 3 Lehigh tiny house villages. We're talking about Aspen Court. And all of those are typically functionally full. Stability site, same thing, right? So maybe they have 1 or 2 units available. Typically there's a household they're trying to move into that unit, right? So functionally full. And really you're left with our non-congregate option, or rather our fully congregate option. So we're talking about Shiloh Baptist, which has been closed basically for new entries because of COVID outbreak. And you're really getting narrowed down to our large 2 congregates, which is Tacoma Rescue Mission and Nativity House Shelter. And so those both will take people en masse, pretty much beyond their capacity, and beds are available. But congregate's a more challenging model. So you aren't forced to, it's Nativity House is an enhanced shelter, so you don't need to leave during the day, but it still has limited goods. You're still in a, pandemic and a congregate setting with no private space. So those can oftentimes create significant barriers. They have curfews, timing associated with them. I don't know if the rescue mission right now is operating with a day center or not. Sometimes they are, depends on their funding, honestly. So when you talk about, do folks have options? The answer is typically no, especially for individuals that may have been banned for reasons from the rescue mission or Nativity House, right? So there can be individuals where there simply is not a shelter option available. And that's a challenge that we need to be working on. I have, I think, 4 shelters kind of in the works that I'm developing and I think have funding streams for, but that isn't now, and that's not as much as we need, right? Like we need scores of shelters, and to imagine that 1 more shelter is in some way going to be, dramatically improving the situation. It serves people, right? It obviously serves people. We serve more now. Every shelter matters. Every bed matters. Every provider willing to bust their butt to make it happen, is a hero, right? It is a non-trivial process. But again, the scope of the problem demands substantially more, right? If I'm not doing county talking points or city talking points or anything other than our comprehensive plan and its expectation of, increasing our 1,280 shelter beds to 3,300 shelter beds, right? And if we can do it with permanent housing instead of shelter beds, fine, right? I'm not going to frown at adding that type of capacity to our system, but that's the scope of what we need to do. And I always appreciate when people are talking to the level of that need. So to Richard's point, I wouldn't call it a failure of outreach. I mean, what are they selling, right? What are they offering? Oftentimes nothing that the people can take. And so again, longer amount of time, absolutely all for it, right? More outreach work, right? To help folks develop relationships, all that's good. But, we haven't given our outreach workers great tools to help people move into shelter. Not because our shelters aren't good, but because, we need more of many different types. Blah, 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 blah. Thanks, Rob.
Appreciate the perspective, Garrett. So Janet, did you want to ask additional information or?
I just still wanted to understand, and maybe somebody on the call, if Richard's not there, are people he said they weren't accepting shelter, you know, that the unhoused were not accepting. And I did not know that if, well, there's not the right kind available for me, or if they just said, no, I'm going to stay out here, I'm not going to a shelter. And that's just what I was trying to get clear. How many people are saying, nah, I don't want to go?
Yeah, I think Jeffrey can address that.
Okay, thank you. I'll put my hand down.
Hello, Janet. I think what we tend to fail to remember is incongruent shelters where they're all in a big room together. You can put blankets up and all that, but the bulk of our COVID outbreaks with the homeless were directly involving the congruent shelters. That's where they showed up. And so how are we taking the responsibility of possibly putting somebody in a congruent shelter where they could possibly die? That's wrong, flat out wrong. And I think as a coalition, we need to stand up and tell the city, this is wrong. You cannot do this.
Yeah. Thanks, Jeffrey. And then there's somebody on the phone, and then I see you waving your hand, Monique. So we'll get to you in a second. Patricia, is that you on the phone with your hand up?
No, I'm sorry. It's Sarah with the Tacoma Rescue Mission. I just wanted to update that we do have our day shelter open. It is event tent in our courtyard. We still serve breakfast, lunch, and dinner. Sorry, my son wants to add too. But yes, we still have our day shelter open and available to shelter guests and non-shelter guests.
Okay, thank you for that. Gerald?
Yeah, sorry that I haven't got this information to the coalition sooner, but I was out myself up until about 2 weeks ago with COVID for like three weeks. But we've been working with the city, as to Rob's point when he was saying, you know, the search to find shelter or low barrier shelter. So we've been working with the city, and we're in the process of actually building a low barrier shelter here on site. We kind of got a little delay with me being sick, and then we have a friend that lives there as well that we've been trying to pull off. But we're building up those tiny sheds, and we're making them for individual spaces where we're going to house 32 to 36 individuals and make it very low barriers. So the city has reached out and tried to support us on that, and they have been supportive. We just got to get the project started, so we should be getting that pretty soon.
That's great news, Gerald. We'll look forward to hearing, and when that gets ready to come online, it'd be great to kind of hear a presentation about that and an update on RISE. So we just need to get you scheduled. Fantastic. All right, so I appreciate everybody's time this morning on this conversation. I do want to move on with our agenda. I do urge people, if you have questions and comments, please do use the chat so that we can both respond to those and also just kind of gather the information so that we can inform what we are going to do moving forward. You know, as Richard referred to, we have a statement as a coalition that we approved back in October regarding sweeps and I know folks have challenges with that language, that we have been using that quite frequently in talking with the media and with elected officials. I understand the frustration. It definitely doesn't feel like enough, especially when you're seeing a couple hundred people being displaced and looking for somewhere that they can safely go. So again, appreciate the conversation this morning. I want to get to our community spotlight session next, and then we're going to hear an update from Poe from the Washington Low Income Housing Alliance. I see you on the screen, Poe. Welcome to the meeting. But first, let's go to Andrew Gelston from Just Threads, and I give you a few minutes to talk about what Just Threads is.
Morning, everybody. Really glad to be here. My name is Andrew Gelson. I'm the Alternative Program Supervisor for Pierce County District Court. Just Threads is our feature resource at the Pierce County District Court Resource Center. And you know, hopefully in the near future, when we're open to walk-in traffic, we can have our manager Dom Hardiman in here to talk about the wide variety of services we have planned through our collaboration and partnerships with community agencies. Once we're back open to walk-in traffic to serve people for those services. But Just Threads is the initial resource that we were able to start when this clothing bank was created in 2018. I think the fall of 2018 it was officially open, and it's been the most popular resource that to date. A lot of people know where it is now and are dependent on it. We have a lot of repeat customers that come in to use the clothing bank and the services. It's not a clothing closet. It's not really, I mean, you can call it a clothing bank, but it's a clothing store, really. When you come in and look at it, it looks like a store. You know, we have our clients' dignity in mind when we're serving them. So, you know, we want to make sure that they feel that we've really thought this out, and we think it's important that they get quality items that are going to serve their needs. But as I was going to say, that the pandemic kind of put a wrench in our walk-in services. One thing that we could do, or one thing that we thought of was with our clothing bank was to do takeout. You know, kind of like restaurants were doing takeout. Well, you can't have people in the building or coming in the building, so why don't we just prepare, you know, packages for people to come and pick up? People will knock on our doors. People will call our number. With the assistance, you know, they'll call from, if they have a phone, they'll call from outside. We have the number on the door. Or they'll have somebody that's assisting them, a treatment provider, call on their behalf, give their sizes and needs, and we'll do what we can to fill their orders. We have casual wear, we have, you know, interview professional attire, a whole host of, you know, different garments for different needs. We serve everyone. We are sponsored by Pierce County District Court, but you know, we're serving everyone, and there is no special referral process. You know, however someone can get connected to us, you know, we're gonna meet them where they are. And sometimes, you know, I strike up conversations with people on the sidewalk, you know, just passing by and letting people know, hey, you know, we have to offer in here. And other times people will patiently knock on the door until they, you know, until they get a response, and we'll respond and fill their needs. We recently added a partnership with Eloise's Cooking Pot Food Bank. It's been outstanding. It's a great pairing with the clothing bank, and we will send people on their way with some groceries. Generally, what we try to do is we try to supply, or we try to stock our food pantry with items that can be eaten on the go. And other times, you know, we do have some people that do have housing in the area, and they'll use some of those things that take a little more preparation, and they can do that in their kitchen. And you know, when somebody's coming in for services from our clothing bank, we're not going to assume that that's the only thing that they need. So we do engage in a conversation with them. I think, you know, a lot of times people in need and dealing with the stresses of being without a home, they have a one-track mind, you know, it's survival, and we totally understand that. And so, you know, we want to help to uncover some of those needs that they're really not thinking of at the time. And if we can develop long-term relationships to address some of these needs, that's what we're going to do. And we have been successful, you know, in doing that. And that all started with somebody just requesting a t-shirt, you know, or sometimes a pair of socks. Support for the clothing bank started out coming from our district court employees, and we were flooded with support and donations. People love to help out and be a part of something bigger than themselves, and we were pretty sure of that, you know, that we had those type of people within our organization. And then we started accepting donations from other county employees, and then from there, other people wanted to, agencies and such wanted to be a part of it. And so they offered donations as well. We have a large demand for men's casual attire and well, men's and women's casual attire, and shoes. And that's something we're always trying to stay ahead of. And so if anyone would like to offer support, as well as referring individuals, or even to look into getting a supply of in-demand clothing for yourselves when you're working with someone, you know, to have on hand in case if someone reaches out to you, we can assist with that. Just give us a call and we'll figure out what to do, how to best serve you. Teresa?
Actually, Monique had her hand up first.
Oh.
Thank you, Teresa. So Andrew, I'm not sure how I can do this. I read when I first opened my nonprofit that a nonprofit cannot donate to another. However, I received a donation, a man closed his store in the mall. I have hundreds of pair of jeans, and these jeans are brand new. They're over, you know, they're like $160 jeans, right? So they're that kind. And there is no way that I could outfit, I could probably outfit every veteran in the state of Washington with this donation. So if I can figure it out, it's not only jeans, it's brand new shoes still in the boxes. And I also have boxes of t-shirts. So if somebody on here can figure out how I can legally donate it, because it makes no sense to be sitting in my storage, then Andrew, you and I should work together. And if you could, I'll put my information in the chat for you. If you could reach out.
Okay, and we can figure that out because we have a legal team as well, and might be different with public nonprofit, you know. But,
okay. If you could ask the question, I'm willing. It doesn't make any sense for it to be sitting in my storage.
Yeah, we like to do things, you know, on the level. We're pretty meticulous about that. So we would find out the answer definitely.
Okay.
Thank you, Monique.
I'll put my information in the chat. You're welcome.
Wonderful. And I'll put my information in the chat as well shortly. Teresa,
you had your hand up too, yeah.
So Monique, if there's a problem with nonprofits taking in-kind donations that are given to them and spreading them through the community, then New Connections is in big trouble, as are a lot of other ones. So I leave it to people who are more legal to answer that question, but I can tell you that if it's something that is not condoned, it's certainly not enforced. So the other thing I want to ask Andrew is, what about, you know, you talked about people who are doing outreach could ask for specific things from you. Would you allow an outreach person to come into Just Threads to look around and take some things that would be useful to them, or are they also not? Okay.
Yes.
So they would make an appointment with you for that.
Yeah, or just come and knock on the door. I have an open door even when it's closed. So that's kind of my, you know, so if I answer, then yeah, then I'm willing to help you. So yeah, so just you would just contact me.
So do you want me to copy and paste your contact information into the chat, or do you want to do that?
That would be great. That would be great. Yeah.
People, give me just a minute. I got to go fetch it.
And one other thing, you know, a lot of things that we have done here have you know, have been, you know, have happened because we've had great ideas from a number of people that, you know, that specialize in areas that we don't, or that have needs that we just that we wouldn't think of. So, you know, we welcome discussions on, you know, creative ways that we can help each other. So I'd like to encourage that. Please reach out. We always love connecting with our community members, and I'm going to be on here on a regular basis from this point forward. So hope to get to know you all, and I recognize a heck of a lot of names, you know, because over the years I've seen your names, and that's a good sign. So thanks for having me.
Yeah, thank you for coming today, Andrew, and we'll look forward to you joining us going forward.
Wonderful. Thank you, Rob.
Yeah. So let's shift gears. Do please share questions and comments in the chat again. And Andrew, I don't know if you could see the chat, but there were a couple of questions about how people can donate that you might want to respond to in chat if you have the ability. So I want to shift and go off of our agenda a little bit so that we can get to Poe from the Washington Low Income Housing Alliance. Welcome to the coalition meeting this morning. And if you want to introduce yourself and tell us how we can help with advocacy, that would be great.
Thank you. Thank you, Rob, for having me. And thank you, Andrew, for all your work and everyone else. I'm blessed and honored to be in space with you all. My name is Paul Epai. I'm the advocacy organizer at the Washington Low Income Housing Alliance. I am newish, a couple of months now. It's an honor to be on the team. I am also an impacted community member, impacted on housing instability in numerous fronts. I experienced homelessness months after my release from prison about 16 years ago. So I'm just honored to be here in space. So I'm just gonna get right to it if you all don't mind.
Do you need to share any slides, Poe? Could I?
No slides. I have
Okay.
two links, just 2 links I'm going to paste in the
Perfect.
chat, and then hopefully y'all can navigate your way there and follow along. Today, especially amongst all our priorities at the Housing Alliance, I'd like to highlight 2 of them. The first one is House Bill 1904, and we're asking for support behind House Bill 1904. 1904 gives tenants time to establish and maintain housing. And here's our current action for our push for support behind House Bill 1904. And I'm gonna paste it right here in the chat. Here we go. Sorry for the delay. I'm not the most tech savvy person, so bear with me, thank you. So that's our current action. We drafted up in hopes of getting the word out and getting support. So specifically, House Bill 1904 states that landlords must give at least 6 months written notice for any rent increases over 7.5%. If a landlord increases rent over 7.5%, tenants can quit their lease and move out without penalty, but must give 45 days written notice in order to do so. The final detail in there that I want to share was that late fees are capped or are limited to $75. There are currently no limits on how much landlords can raise their rents in Washington, and tenants are experiencing an exuberant rent increases in communities all across the state. When a tenant can't afford a major rent hike, they often have to move with as little as 60 days notice. This amounts to an economic eviction, and some landlords raise rents as a way around eviction protections. There are more than 1 million renter households in Washington and over 229,000 extremely low-income renter households. More than 2/3 of extremely low-income tenants pay more than half of their income on rent. We continue to hear complaints about rental increases throughout the state. A Spokane resident just reported a $1,000 a month increase on a month-to-month rental with no time to prepare, upping her rent to $2,200 a month. We believe that is unsustainable and unacceptable. Now, I would like to switch gears a little bit. In this next link that I will be sharing with you all are our 2022 Housing Alliance priorities, and I want to share that with you all here now. There's the chat. All right. And this is everything behind our 2022 legislative session. After today, we have 4 weeks, by the way. And so there's that. There is one I'd like to highlight. I'd like to highlight one of our budget acts that is dear to my heart, partially because of my experience with homelessness, but also because of the people who were there for me and pulled me in from the streets. Our $78 million ask for homeless service providers is very important to us. In that link, you can follow along. The tab says Workforce Capacity and Sustainability for Nonprofit Homelessness Service Providers and Permanent Supportive Housing Providers. Our state's ability to prevent and end homelessness rests on the shoulders of nonprofit workers across the state who assist people in crisis. The pandemic has strained homelessness nonprofits. Frontline workers face hazardous conditions and experience significant trauma while earning low wages. Many are just one paycheck away from homelessness themselves. The legislature should invest $78 million to address staffing shortages by providing hazard pay, retention, and recruitment bonuses, secondary trauma resources, and other supports for the frontline workers who are so critical to ending homelessness. If you are interested in helping to push that, please email me or my mentor, my boss and colleague, Michelle Thomas. I will put Michelle's email here as well as mine in the chat. Please don't hesitate to reach out. Just like Andrew, even when the door is closed, it's really not closed, including weekends. So please take advantage of our information, our contact information here, and reach out. Make sure that's legible. Okay, so yeah, there's my address and Michelle's. And thank you all so much for the time and space and be able to be here to share with you all. I'm here for any questions or input or feedback. Thank you.
Great, thank you, Poe. Anybody have any questions or comments? Just use the raise hand function if you have anything. I'm seeing thumbs up and hearts, so.
Thank you all, I appreciate y'all, much love. Thank you.
Thank you. All right, so let's shift over to our, and I'm kind of wheeling and dealing with the agenda here because we went over time a little bit on our rich conversation about the current situation on the streets. So let's move over to government updates and we can be on time with that section of the meeting. I believe Chiquata Elder from the city of Tacoma has joined us. Did you want to share? I know you had some information you wanted to share with the group this morning.
Yes, thank you, Rob. Can you guys hear me?
We can.
Okay. Yeah, I apologize. I've been flip-flopping back and forth. I usually have this on my calendar every Friday, and for some reason it didn't make it on my calendar and somebody else put something on there. So I had to hop into another meeting and then I was cutting them short and I was like, gotta talk faster, I gotta get back into another meeting. So I'm back and I'm out of breath and I've been sitting in my chair the whole time. Doesn't really make sense, does it? So I'm Chiquata Elder, landlord tenant coordinator with the city of Tacoma out of the Office of Equity and Human Rights. A lot of you guys know me already. I've been here before. So I just kind of wanted to give you an update. As you guys have heard me say before, the city of Tacoma, we're in charge of the rental housing code that we have, which is different than the state law that has some additional protections for tenants outside of the state law, one being an enforcement mechanism. So we are currently working on our rental housing code with some proposed changes. We had some proposed changes that went through in October, and the biggest one that went through was just cause eviction that had went through at the state level, and so we adopted it at the city level so that we can have an enforcement mechanism because they don't have the enforcement at the state level. So we got that through in October, but there were some other proposed changes that we didn't get through at that time, but we still feel they were important, such as regulations around shared housing, regulations around late fees, landlords' ability to evict tenants if they don't have a business license, landlords' notice of sale to low-income housing or low-income housing. And then there was one more, can't remember off the top of my head. So we are working on those things. And so we have a stakeholders group, and we have that comprised of both landlords, tenants, legal for both sides. We have the city of Tacoma representation. And so we've been working on those things, but then what we've come to learn is that there's things that's at the state level, and I think it was Poe, is that who was just speaking? That was just talking about some of the things that's at the legislative level, such as like rent increases and notices and things like that. So we've come to look at some of those things that we weren't thinking about as proposed changes in our rental housing code at this time can still have effect on people in Tacoma. So if it goes in the state legislation, we have the ability to, of course, adopt it into our code to make it part of our rental housing code. But if it doesn't make it into the state legislation, is that something that Tacoma, some of those components that we can, because there are pieces of it at the state level that we wouldn't be able to adopt. But are those some things that we at Tacoma some of those components that we should be thinking about in Tacoma, because we did have the 60-day rent increase notice, but should we be looking at longer notices for some of those bigger rent increases that are at the state level if it doesn't, pass at the state level? So I just want to kind of put that out there, that these are the things that you might be hearing from us, even though we had this set of proposed changes, that as I'm hearing stuff and as things are coming across at the state level, I am taking a look at, if it doesn't happen at the state level, what we could still be doing at the city level. And these conversations are going to be happening, and we're going to need, your voices and be coming to you guys as we're going out into the community to get the feedback. And so to be looking for that. And so we may be, we'll be having like community events and things like that. So we may be asking, to you to come to community events, or for you to host a community event, like for feedback and things like that. So I told Ron I'd keep it short, but yeah, I just wanted you guys to know what I was working on and where I was coming from. So, yes.
Thank you. And I'm glad you could shift back over here to this meeting quick stop.
And I'm really trying to figure out why I'm out of breath. It's probably because I ran to the kitchen to get some water before I sat back down. That's what it was. That means I need to start working
things
out.
Just sit differently in this Zoom stuff. So yeah. All right. So I don't know if we have anybody else from the city of Tacoma here to do any updates today. I'm not seeing anyone. So let's shift over to Pierce County Human Services. Jeff Rogers, I see you're on the call. Do you have information for us today?
The only thing that I can share is that today is the deadline to submit any applications for our homeless housing program funding. That's the largest pot of funding where we fund everything from outreach to permanent supportive housing and everything in between. Make sure your application is submitted on time. Every year, someone submits them late and they're not considered. Today at 4:30 p.m. is the cutoff. They have to be sent by email and they have to be received in our email box by 4:30 p.m. our email date and timestamp. So if you're still working on one, please get it in. And announcements will be made in about 6 weeks of who will be receiving that funding.
Thank you, Jeff. Let's shift over to Valerie with updates on rental assistance.
Hello, hello. So yeah, second that, Jeff Rogers. Someone always submits late. Rental assistance, we have spent $92 million since January of 2021. Right now we're averaging about 7.7 million per month. So big shout out to our 9 amazing providers. That does not include the City of Tacoma funding, which they are doing fantastic as well. The portal is currently closed. We are shifting to a new portal, which is going to be more user-friendly for both tenant and landlords, as well as offer updates. And so people will be able to do a reset, their login, and apply as soon as that's up and running. There's a contract issue, so out of my hands. The new portal will require documentation to be uploaded. So if you're helping people apply, there is a list on our website of documents that landlords and tenants must have to be completed as to be considered a fully submitted application. One thing I will say is there's some confusion in the community about what we do. We receive a lot of folks at our housing help events from shelters. We receive a lot of folks who are living in their cars referred by homeless service providers. And unfortunately, that's not what we do. We are a prevention program for emergency response, meaning COVID impact, already in a unit, has a lease in their name. We can help maintain that unit. We are not in the business of housing searches, and we are separate from the housing authorities, who are amazing partners of ours. So just to clear that up, I love visiting with all of you when you stop by our events, but unfortunately your folks do get really frustrated because I have to send them back to you, and I do refer them to coordinated entry. So just share that in the community. There is no current update for the timeline, Jennifer. It was supposed to be 2 weeks ago. It was supposed to be the 1st. Now it was last week, then it was yesterday. It is completely out of all of our hands. We are waiting on folks much higher than us to do their portion. So unfortunately, our hands are tied. If someone has a 14-day notice or an eviction notice, send them to the Center for Dialogue and Resolution, send them to Tacoma Pro Bono. They will work with them and start the process, and then they will ask us to expedite once we are opened. So we are also prioritizing households. No one's higher than you. There are a lot of people higher than me. and it's almost my birthday. So there you go. So we are prioritizing households that are unserved at this time. So if you have folks who applied previously, they will contact their provider, get on a wait list. Thank you. And then we will get them into our list to get them served as fast as possible. Oh, and we did ask for $32 million more. So we're just waiting for the Treasury to decide if we will get that. A pay raise. Thanks. Yeah, 41 should have a pay raise, right? I mean, I realized today I've been with the community of Pierce County for 10 years this month. MDC hired me 10 years ago. So that was cool. That was cool to realize. So yeah, that was great. But that's it. So if you have any questions, feel free to let us know. I am a team of 1 today. That's true, Jeff Rogers. I did, didn't I? Didn't even look. I will. Yes, thank you, County Exec and Council, for my pay raise in January. So.
All right. Thanks, Valerie.
Yes, thank you. Oh, and I support 100% everything that was announced from the Housing Alliance. We're seeing ridiculous rent increases. I mean, $1,400 a month of rent increases. So 100% support that.
Yeah. Amen. So let's shift over to our weekly update from the Tacoma Pierce County Health Department. Jenny?
Hello, good morning, everyone. I'm going to keep my update short, and people can feel free to ask questions or send me questions. Get vaccinated. I'll share a link. Testing, we're doing great. I think a great job with increasing more convenient testing options. So 7 days a week at Cheney Stadium, that kind of thing. Walk up versus appointment. Testing, you've probably heard, has went from like last month where it was very crucial, people couldn't get tests, to now the demand and supply and demand and access has kind of leveled out a bit. So I understand that you're working with folks who don't always have, who face a lot of barriers to that, but please reach out. Our testing team is great about working with individual community-based organizations, shelters, and others to get you what you need and get folks where they need to go. So I'll drop things in the chat around vaccines and testing. But I wanted to share, Rob and I were talking about, I've been talking in other groups about how I'm putting in some data requests internally to look more at our data related to people experiencing homelessness in terms of vaccination rates. And I'm working with our data team on that. And I was looking for another request internally about how many vaccine doses have been given in this community through some of our events. And so that got me thinking, and I'd asked Rob if I could share just a little bit about that. So this is, I'm going to share my screen, and this is just like estimated data that I thought it might be nice for folks to see numbers here. Okay, so Rob, I just pressed the screen. You've given me permission, right?
I have.
Okay, cool. Oh, shoot. I'm not familiar with doing this on Zoom. Do folks see the slide or?
Not yet.
Okay, do you see the rest of my screen? Hopefully not.
No.
Okay, good. Not seeing my emails or anything. Okay.
All of your emails, we're seeing them. And actually, I'll respond to them right now.
Oh, good. Would you? That would be really great. Let me just make sure I've got nothing else up. Sorry.
Did you change the slide from yesterday? I could always share it too.
I did. I made a couple tweaks.
Oh, okay.
Okay, let me try this again. Everything's shut down here. Sorry, folks. Okay. I think we're.
There we go.
How's that? Okay, I realize it's kind of a funky view. Well, we'll go with it. We'll go with it, guys. Thanks for your patience. This is good as it's going to get for me on a Friday morning. So these, again, are just estimates. This isn't official data. This is sort of me crunching the numbers I have that I've been tracking of COVID-19 vaccines and others, other doses administered at shelter and day center sites from April of last year to date. So most of you know we've been working since last year to establish, close relationships with shelters and day center sites and other community orgs to do vaccine clinics that prioritize the community of folks living homeless. So to date, we've got 870 doses administered at our shelter and day center vaccine events. So that's kind of cool to see that number. I was a little bit surprised and happily surprised to see that. We did an additional 200 doses that were administered in the encampment. So that is through some of the work that our own mobile teams from TPCHD, Tacoma Pierce County Health Department did. And then some of it was with medical team. So sorry, I want to give a proper shout out. So our work was in conjunction with Tacoma Rescue Mission and the team at Comprehensive Life Resources. And then another bunch of those vaccines administered encampments were through a partnership with Medical Teams International, MTI, and Greater Lakes. So shout out to TRM and Comprehensive Life and Greater Lakes for their partnership and their amazing work. The MRC, the Medical Reserve Corps, has also served 60 clients in some recent vaccine clinics that they did. And those are flu as well as Tdap and pneumonia and hepatitis A and B, so other vaccines. And I'm waiting on some final data around that to look at how many doses were administered. So that's kind of a big picture. This is an underestimation of the work that's been done and the vaccines that have been administered, because these numbers that I have don't include several of the one-off community events that have been done both by TPCHD and others. And then recurring events. We've done, I don't know if I could say hundreds, but we've done a lot of events at food banks and churches and other sites where, though those events might not be specifically prioritizing or targeting, for lack of a better word, people experiencing homelessness, we know that they have served those folks. So yeah, Again, I'm looking at data to try and get better, more firm, less sort of estimated preliminary data on these, but wanted to just share that with folks. And I will stop my screen sharing, but does anybody have questions about this or about anything else that I typically share on these meetings regarding to, vaccines, testing, anything?
I'm not seeing any questions right now, but if you can hang and check the chat,
absolutely,
that might be helpful.
Absolutely. Thanks as always for having me, and thanks everyone for the work you're doing. I'll be here till 11 if you have questions.
Thank you. All right, so let's shift to a topic that I think we all need to deal with a bit, and that is Verna has actually offered to do a short training with us today around compassion fatigue. So I think I've given you, you have co-host ability, so you can share slides, and I will step aside and thank you.
Well, boy, I sure need to say a big thank you to all of you. I'm looking around at this group, and even some where it's just their name that's showing, not their picture. I don't think I could be in better company. And I just want to take a second and appreciate that. And also I want to share my condolences with Poe, having lost 8 loved ones in the last year. And Chiquita, out of breath. It wasn't just from the run to the kitchen. It's because you're multitasking big time. So that's what I kind of want to talk about a little bit here. Let me get myself situated. All right. So we're dealing with this. Can everybody see the whole screen? Because I'm seeing some of your faces. You can see the whole screen? Okay, great. I'm going to cheat and scooch some of this out of the way because I know what my slides are. Okay, so in the last couple of years, some of us have been in hospitals either as workers or with loved ones, or kept outside because we couldn't be with our loved ones because of COVID. The lady in the middle with the white mask is, I'm imagining she's in a Zoom meeting for the 100th time and at her office, but still on Zoom. And we've all learned how to talk with masks on. And I use my hands way more than I used to when I talk to people now because of that mask. Some people have lost their jobs. Down below her is a couple of people standing outside visiting, a few feet apart, wearing masks. And then bottom left and middle, those are the people that were here in this meeting serving, and they're hit by COVID too. And the masks that they're wearing might be 4 weeks old, who knows? Maybe they don't have a fresh mask. And what all this does to people when they're feeling all of this come in, is it makes us feel, I'll put myself in there too, it makes us feel like that woman on the bottom right, isolated, alone, overwhelmed. That's what happens when we're feeling stressed like this. So let's talk about that just for a second, managing our expectations. We can't realistically say, okay, no stress, I'm just going to ignore it, it's not here, flip off that switch. Doesn't happen, does it? And not all stress is bad. We need a certain amount of stress. Over here on this side is healthy stress. This is get up off your keister, off the couch, and go do something stress, okay? I've got a job to do, I'm gonna go do it. I'm motivated, I'm focused, peak performance up here at the top. But then the stress doesn't stop, does it? It keeps coming and it compounds. We have our work stress, we have our family stress, we have COVID stress, we have I don't feel good stress, we have do I have COVID stress? And now we're getting into the way too much stress and we're overwhelmed, and that's counterproductive. It hurts us, it hurts our bodies. So that's the kind of stress we don't want. It's kind of like a guitar or any other stringed instrument. You need a certain amount of tension to function properly. But if you stretch it too much, any of us, all of us have a point where it's too much and we break. And you don't want to be close by when that guitar string breaks, right? If any of you have ever had that. So this might be a little bit risky, but I want to ask you guys a couple questions, and I hope a couple people will speak up. When you're feeling stress, what does that feel like in your body? Like for me, I feel stress in my chest. I feel it in my face. My hands will kind of get stiff and tight. And then what kind of an impact does it have on our lives? Again, for me, what happens is I have trouble sleeping. I'm laying there at 3 o'clock in the morning thinking of 15 things that I have to do, or something that didn't go right, or someone who really ticked me off, all of those things. Can someone else share a little bit about what happens to you when you're stressed? Anybody? Any takers? Rob?
Yeah, for me, I just find myself responding to things in ways that I wouldn't normally. So I find myself saying something, even though I'm sitting at home, I'm angry at a coworker and I'll use a name that I never would use. You know, it's just, you can tell you have a short fuse at times.
Vern, I feel it in my head. It feels like being crushed, like lots of tension in my head.
Yeah, yeah. I can only see 5 of you at a time. Anybody else have anything to share?
There are some things in the chat.
Okay. Anxiety, shortness of breath, not my best self, chronic hyperventilation. Breathing from the top of my chest, my blood pressure goes up, cry, always tired. And what Monique said about pressure going in on the head, actually in my head, it feels like an explosion. Patricia, your hand's up, I see.
I just start forgetting things. Like it's like a brain fog and I start forgetting things. Thank you.
And because this is a group of people that cares deeply, that stress, you feel it deeply. You know, if you don't care, if you're oblivious, yeah, right? But because you folks care, this is a big deal. And the stress hits us hard because we care. So let me move down here. What do we do when we have stress? Okay, typically in our culture, what we do is the red dots at the top. We take stress and we remunerate on it. So that's like a cow chewing his cud. I'm so mad at that guy. I just can't handle this anymore. What am I going to do about this? And all night long, you're doing this over and over and over again. That's remunerating. Criticism is that angst, that frustration you feel when that's not the way it's supposed to be. And maybe your finger's pointing at me. I can't get enough done. And then stoicism, our culture says, just buck up, take it, ignore it, put your stress, put your feelings in a box over there. You don't have time to deal with that. Well, all of those responses lead to chronic stress. They lead to very negative health outcomes in our body. Our body says, no, you're going to listen to me now. We're going to crash, right? Has anybody here ever crashed because you just couldn't do anything more? That's what happens. So now let's look at the blue lines down at the bottom, the blue dots. There's another way to handle stress. This is what I want to talk about briefly. Stress plus compassion equals resilience. Well, gee, what do I mean by compassion? How can I have compassion here? When we talk about self-compassion, it gets kind of icky feeling, you know, it's like, you know, I'm not sure what that means or how to do it. But think about this. Think about someone else that you feel warm and tender in your heart when you think of them. Maybe it's your kids, maybe it's your dog or your cat. Maybe it's someone that you're mentoring and that you really become attached to them and you really want to see them succeed, but you have compassion for this person. Okay? Have you got that person in mind? Take that feeling, adjust to the angle, and hold it for you. The same compassion that you give to those people you care about, you need it for yourself in order for you to be resilient. That's the important thing to remember there on that, okay? Your life is just as important as any life you're serving. We sacrifice ourselves every day, all the time, but we don't sacrifice our value the importance of who we are as individuals. So we want to remember to stay compassionate for ourselves. I'm looking at a couple people in particular right now that probably push that too far and ignore it too much. I won't name names, but remember to hold compassion for yourself. Everybody has seen the message of what we're supposed to do. And I hope you'll forgive me if I'm not seeing chat while I'm talking. If someone needs to interrupt me, that's okay. Just let me know. So everybody knows about types of self-care. We're supposed to exercise. We're supposed to practice meditation and being calm. We're supposed to get out and do things with our friends and be social. And we're supposed to do things that feed our spirit. Yeah, we are. Those are tried and true and overdone because they have value for us. You'll notice that some things kind of end up on the list several times. The key thing is to see the thing that works for you. Actually, there's two keys. What works for you. And the second key is, if I can't do everything on my list of things to do for self-care, I know I should exercise, I know I should do this, I know I should do that. Don't abandon the whole list. What can you do for self-care? Okay, and before we're done here, we're going to do something that's going to take less than 60 seconds for self-care. So don't go, well, I can't do all the things I'm supposed to do to take care of myself, so I'm just going to push on through. Or I'll do it down the road or later. Or next week when we're done with this pilot program or whatever like that. No, today. Something for self-care today. I see Teresa smile when I said that. Something for self-care today. And don't forget your buddy. Okay? We are not alone in this. Think about someone in your life. And the cool thing about finding Nemo and Dory there is neither one of them's perfect. None of us are perfect. Nemo's got his special fin that he talked about, and poor Dory and her short-term memory, right? We don't have to be perfect buddies to each other, but we all need a buddy. Okay, so remember that. All right, here we go. This is going to be pretty quick. In a couple minutes, we'll do an exercise, but I want to run through the basics of self-care that you can do every day real quick first, okay? So think your happy place. I don't have a place that looks like that, but I've got places that are pretty that I can imagine. Think your happy place. We know we need to drink plenty of water, right? Water hydrates your body. This is an important point. You want to speak your body's language. Your body does not talk English. Your body talks chemicals, hormones, neural pathways, synapses. Okay, that's the language your body talks. Talk to your body in its language. One of the ways to do that is drink plenty of water. Okay. When you drink, even if it's just one glass, okay, I can't drink 6 glasses a day. Okay, don't. Drink 1. Do what you can, okay? So just to demonstrate, I want to show you the proper technique. I have an assistant. Let's see if I can get this. This little guy's telling us, this is how you drink your water, okay? So, and he knows how to enjoy it too while he's at it, right? Okay, so drink water. Another thing that's important to do when you can, even if it's just around the block, take a walk. Just take a walk. This is a picture I took of the pathway through the park near where I live. It doesn't have to be a big hike. It doesn't have to be, you know, there's all these places here around us that are nice walks. Go take a walk. It will clear your mind and feed your soul, I promise. And your work will be there when you get back to it, right? It's one of your most faithful friends. Your work is always there, so you can take a walk and come back and it'll be there waiting for you. And then remember to breathe, right? Now, when you breathe, when you're stressed, a lot of times the reason we feel tight in our chest is because we're not taking a deep breath. We're not going. And a trick I used to tell my patients, even little kids, when I was giving them a shot, was breathe down to the place in your tummy where it feels tight. Take your breath all that way down, so it touches that spot, and then slowly breathe out. And what it does is it helps release that tension in your body. When you breathe in, You're oxygenating. When you breathe out, you're speaking to the part of your nervous system that says, okay, I'm okay. We can shut off the flight or flight response. Okay. So that exhale is important too. And that's why you're telling your body you're okay, talking your body's language. Okay. So here's our 60-second exercise. Everybody who's willing to and able, just sit up with your feet on the floor. Relax your hands in your lap. You don't have to have any special position. If you feel comfortable doing it, close your eyes and take that slow breath in. Hold it for a second and slowly out. Feel your feet on the floor. Feel that physical sensation. Feel your hands in your lap. Take a slow breath. Listen. What do you hear around you? What's going on in the room where you're at? Take a slow breath. Do you taste anything in your mouth? I've been drinking coffee all morning. I'm still tasting coffee in my mouth. Take that breath. My eyes are closed, so I see the inside of my eyelids. Just noticing. Take a breath. Feel your body again. Notice where there's tension. Just notice it. And when you take your breath, imagine it going to that spot. And when you exhale, imagine it being released. And now slowly open your eyes. You have just done a self-care exercise. You can do that in 60 seconds or less. And it feels like that's all the time we have a lot of times, right? In case anybody needs any resources, I'm going to copy and paste this and put it in the chat. You might not need it for yourself, but you might need it for someone else. And this is a picture that I have right beside my desk that I look at every day. This surfer is on a wave that wants to kill him. It does not want him to succeed. That water is rough, the surf is hard and pounding, and he needs to get it just exactly right or he's going to crash, right? But look at him, he's making it look easy. He's having the time of his life. This is his response to the situation he's in. And so as I go through my day, I picture myself on that surfboard and I'm like, okay, you got to stay balanced, make it look easy, have fun with it, go with it. And if we crash, that's okay. We'll get back up and we'll catch the next wave, right? All right, folks, that was my presentation. Thank you for your time so much.
Thank you, Verna. I think, especially given the frustration we were all sharing with each other early in today's meeting, it's helpful to think about these tools of taking care of ourselves. So I really appreciate you. So what we wanted to do as a follow-up to this was break into small groups and spend a few minutes, about 10 minutes, just kind of sharing what things we do to manage compassion fatigue, share some tips with each other, and just have an opportunity to have a conversation and network with each other. So I'm going to set up breakout rooms with 5 or 6 of us in every room, and we will come back here at 10:45 to resume with what we have left of time for today's meeting. So here we go.
Thanks, Monique.
Welcome back, everyone. Hopefully that was good conversation to come out of the compassion fatigue session. And I want to thank Verna again for that training session today. I think it's very apropos for where we're all at right now. So I'm looking at the clock and we have a lot of stuff that we have on the agenda and not a whole lot of time left. So real quickly, I thought I would offer a little bit of an update from the City of Tacoma's City Council Community Vitality and Safety Committee meeting yesterday. And I know Sally and others attended that meeting as well. I'm going to be very brief. One of the reason that we were all attending the meeting, there was a couple of reasons. One, they were talking about the alternative response study that was done last year and the status of moving forward with creating new avenues to do to interact with people who are in crisis other than sending police officers. I'm not going to spend time on that update, but I will say it was a little bit of a frustrating update because they are trying to move forward, but they just laid out a bunch of barriers and said that essentially that implementation of any recommendations from that study beyond the switch that they've made with the HEAL team will be part of the budget discussions at the end of this year. So that's the quick update on that. The other reason that we were in the meeting was to hear the update about the camping ordinance. And what we heard was that they are still on track to keep talking about the potential for a camping ban, to bring something to the full council at the end of this first quarter, so the end of March. And much of the discussion was about a stakeholder engagement plan that is really going to boil down to the March 10th meeting being a stakeholder conversation and committee discussion that a lot of us will probably want to pay attention to. So that would be March 10th at 4:30, again on Zoom. They talked about the structure and format for that meeting, including what questions it would be included. And I know that a couple of folks who attended that meeting yesterday mentioned the fact that there was frustration, a lot of good discussion among council members who are on the committee, and frustration expressed about the fact that like the 705 cleanup didn't really result in any improvement in the situation, either for people who are homeless or for the community down around the 705 site. So that it simply displaced people. And yeah, thank you, Sally. I think camping is a term that trivializes how people are living. Camping to me is people going out and recreating in the woods. So definitely understand that. But Sally, was there anything else that you think would be critical for the group to hear from yesterday's meeting?
I think the plan to get feedback from the community seemed pretty narrow in scope. They're going to put together 2 5-person panels, which means they're going to hear 10 voices, which seems like a pretty small number of voices, and it isn't really clear how those folks might be selected. And while there was some encouragement to work more fully with people with lived experience, they seem to default to having the city outreach staff people bring their information about what the experiences of unhoused people are, which caused me concern in 2 ways. One, I'm not sure the city staff people will feel comfortable being completely direct about what they're hearing and seeing. And 2, it's still filtering people's experiences through somebody who's getting paid to do something with those folks, and that just makes me uncomfortable in a general sense. So I think there needs to be some push to have a more robust process around people with lived experience, because the further away you get from the people who are unsheltered, the less the policymakers know about what's really going on, from my observation.
Thank you, Sally. So I see a couple of hands up, so let's get to those and then we'll move on to the next item on the agenda. Rosemary.
I just wanted to add that there was some discussion about alternatives to having either no use of public property for living or leaving things as they are, and some discussion about, are there some behaviors that could be regulated by the city outside something that had a ban on actually using public space. So I think there's some creative thinking being attempted, and I welcome the opportunity for us to add whatever we can as alternative ideas to protect people in all kinds of ways, rather than just think we're getting rid of a public problem by saying it shouldn't exist. You don't get rid of the need for housing by saying you can't be in the public space.
Thank you, Rosemary. And Patricia?
Yeah, I just want to say, like, there is a very, to lift up the point of view of lived experience. I'm a lived experience ambassador. And right now I'm waiting for, they took away my EBT and whatnot. And it's been, the last one was 3 hours and 48 minutes to be on hold. I'm here with a case manager waiting for hours to get through. So, you know, what kind of solutions? There is a House Bill 2075 about having in-person sites, but I'm just pointing out, like, I'm trying to create my own solutions, but these are the barriers that I'm coming into. So thank you for letting me share.
Thank you. And Jonathan, I see your comments in the chat as well. When you have capacity, I think we would love to hear an update from the Lived Experience Coalition at a future meeting of the coalition. So just to put that on your radar, it'd be great to hear from you about how things are going and how we can partner. So let's move on to the rest of our agenda in the 8 minutes we have left. Real quick, Jan, do you have any updates from the Safe Sites for All committee?
Just a big invitation for everybody to join us who's interested on Monday at noon. Go to the website to register. Thank you.
Great. And do we have any other coalition committee updates we needed to share this morning? All right.
Rob?
Yeah, go ahead.
At the steering committee, the steering committee discussed representation on a new county advisory board that's going to oversee the implementation of the comprehensive plan. So this is really just a renaming of the steering committee, the group that put the comprehensive plan together. The coalition had its representative of Maureen Howard. Maureen would like to continue with that work, although recognizes she will not be able to, so I'm wearing my coalition hat right now, no county hat. She will not be able to probably be at every meeting, but she would like to still be involved. And so she was recommending Rob as a backup. So basically it would be Maureen, unless Maureen can't be there, and then Rob. Rob attended all the meetings prior anyway. So our coalition policy and procedure is that if we're assigning folks to represent the coalition, in this case being a conduit between this work and the coalition, making sure our concerns are brought to that advisory board. The advisory board is letting the coalition know what's going on and getting advice. So the recommendation from the steering committee was that we retain Maureen Howard in that role with this new advisory board, and or whatever it's called, I should know that, with Rob as the backup. And so what we want to do is, as a coalition, is to have a vote on that next Friday. So our policy is we let you know what we're planning now. We'll go ahead and send an email with the same information, but wanted to let you know that we would like to vote on the representative there. And obviously it doesn't have to be Maureen. So if somebody's interested in doing it, I would recommend that you let us know, and we'll maybe have a chat at the steering committee about that, and we'll definitely have a vote next Friday.
Yeah. Thank you for that, Garrett. And now we do have a couple of minutes. If people have items for the good of the order that they want to share with the larger group, we've still got 38 of us here to hear what you have to say. So if anybody has anything for this week, feel free to raise your hand. Alfred. And you're muted right now, so.
Yeah, sorry about that. I didn't actually really intend to put it up, but okay. But since I'm here, I might as well say something. Now, as far as the community meetings or whatever that are going on, like the city council committee meeting or whatever, you know, what I've seen quite often is they, they get packed in with a group of people that believe one thing, Yeah, and usually it's the people with the money,
Yeah. Thank you for that, Alfred.
Sorry about this, but
No problem. No problem. Garrett, you have your hand up.
Just one more thing. Hopefully you all saw the email about the behavioral health notice of funding availability from the county. I just want to highlight that. That is a chance to Monique's point, fill out another awful NOFA, but RFP, but also to add mental health services into one of your programs. So I won't go into details about that, but I put a link to the NOFA and an email of someone that can give you information. But basically, it's substance use, mental health, and the opportunities are substantial, especially if you have an existing program to add mental health or behavioral health in some way. Thanks, Rob.
Yeah, thanks, Garrett. Tim.
Yeah, so I know that I've been on these calls for a while talking about this mythical project called Dignity City, but if anyone is interested in hearing about that and street papers and empowerment in general, next Friday night, I'm going to be doing a slideshow presentation at Lynn Danino's Tripod Slideshow series at the Center for Spiritual Living. And I'd invite you all to be there because it's going to be cool. And I'll put something in the chat.
Perfect. All right. And Patricia, you have your hand up as well.
Yeah, I just wanted, Garrett kind of touched on it, the need for mental and behavioral health. Also talk, we just did a compassion fatigue, but think about those that are on the streets or dealing with homelessness, what traumas they go through and where can they outlet to talk to somebody. So I want to lift that up. I also want to lift up some of the legislative sessions are just about 4 weeks. So some of these can also be advocated for, and just to think about treatment and how to just listen when you speak to somebody, because there's a lot of traumas that exist with lived experience and while you're homeless. Thank you very much for letting me share.
Thank you, Patricia. And we've now got 2 minutes left in today's meeting, and I always like to end a little bit early if we possibly can. So what I would urge folks is if you have any feedback on today's meeting regarding things that have gone well, things that didn't go well, things we should do differently moving forward, please use the chat to share that. Or you can feel free to email me, and I will put my email in the chat as well if you have feedback. And I do encourage folks, if you have the capacity, to hang on the call. We will be planning for next week's meeting immediately after this call ends. So I wish everybody a happy, safe, and good weekend. And we will see everybody again next week. And if you want to help plan next week's meeting, stay on the call. We'll take a 5-minute break and get right to it.